The hip joint. The hip joint is also known as the acetabular femoral joint because it is the articulation of the acetabulum and the head of the femur. This joint is an interarthrial joint because it acts like a ball and socket.
The hip joint has 7 different movements that it can perform. They are flexion, extension, adduction, abduction, internal rotation, external rotation, and circumduction. We will now go into more detail about these movements and talk about the muscles involved in each action along with the range of motion.
The first is hip flexion. Hip flexion is described as the bending of the joint resulting in a decrease of angle. The normal range of motion for hip flexion is 0 to 130 degrees. The muscles involved in this are pectineus, the iliopsoas, the rectus femoris, the sartorius,
Second is hip extension. Hip extension is described as straightening the joint resulting in an increase of angle. The normal range of motion for hip extension is 0 to 30 degrees. The muscles involved in this movement are gluteus maximus, biceps femoris, semitendinosus, external rotators.
The third is hip abduction. Hip abduction is described as moving the thigh away from the midline of the body. The normal range of motion for hip abduction is 0 to 35 degrees. The muscles involved in this movement are gluteus minimus, gluteus medius, external rotators, tensor fasciae latae.
The fourth is hip adduction. Hip adduction is described as moving the thigh inward towards the midline of the body. The normal range of motion for hip adduction is 0 to 30 degrees. The muscles involved in this movement are adductor brevis, adductor magnus, adductor longus, and the gracilis.
The seventh is hip circumduction. Hip circumduction is described as the leg circling through extension, flexion, abduction, and adduction. The normal range of motion for this movement is 360 degrees.
The fifth is internal rotation. Hip internal rotation is described as turning or rotating the thigh or pelvis inward. The normal range of motion for hip internal rotation is 0 to 45 degrees. The muscles involved in hip internal rotation are a combination of lateral and posterior muscles. The sixth is hip external rotation. Hip external rotation is described as turning or rotating the thigh or pelvis outward. The normal range of motion for hip external rotation is 0 to 50 degrees. The muscles involved in this movement are a combination of many hip muscles such as the 6 external rotators, gluteus maximus, sartorius, and gluteus medius.
The hip and gait. In the determinants of gait, the femur rotates internally on the pelvis 5 degrees and the tibia rotates on the femur as it moves from stance to swing phase. Then the femur rotates externally about 7 degrees during the remainder of the stance and early swing phases. The hip flexes during the swing phase, becomes neutral during mid-stance phase, and then extends on the other leg, goes through the swing phase. Hip initially swings 60 degrees of the swing phase until heel strike, when hip becomes extension until heel off and toe off.